last week, this month I visited Chennai to another conference. In that conference again there was a debate on transplant. And another question was there, with how much creatine will go for renal transplant? What do you mean by end stage renal failure? With that discussion, this question arises, whether some people from Kashmir, he just pointed out that the definition of anuria is going to be changed. I am not sure how much it is changed, that information is even not for me. We will just clear it later on if it is available. Thank you very much. Any question? এখন তার প্রোফাইলের মধ্যে আমরা তাকে ইউরিয়া এবং ক্রিয়েটিনিন করেছি। রিসেন্ট ক্রিয়েটিনিন এন্ড ইউরিয়া 3.8 ক্রিয়েটিনিন and urea 96.2. Urea is 3.8, creatinine is 3.8 milligram per dl, and creatinine is 3.8, and urea is 92.4 milligram. So that is the present. Yesterday evening we have done it. I think he is coming up. If we rely our report from our lab, it was 15.1. This creatinine level estimation sometimes differs from laboratory to laboratory. But in our lab and same investigation we have done from same lab, so we can rely. It was 15, now it is 3.8. Yesterday evening, it was urea was 174 milligram percent and creatinine was 15.1. Now urea is 92.4 and creatinine is 3.8. And I think he is coming up, and physically he is fine. Any question from students or not? That's because we are very much pleased that house is full. Maybe I was interested to bring you up. That's why you are here. But I am happy that you are here. Thank you.
Thank you, Urology Department, for giving such a very nice presentation. Because this sort of urological emergencies, though very rarely we come across, but these are very difficult problems to manage because we don't have that setup to do the management as we desire. And I'm very pleased to see that the gallery is full and the whole office and administration is mobilized to do video and others. And I think in the subsequent presentation, Dr. Riyad will arrange such a full gallery, and also there will be arrangement for video and other things, because quickly I was sitting in the morning here and I thought, quickly why are we here? The vice principal has a presentation. So in other days I had to call quickly, they come with the AC is not working, the sticker is not fixed. So we want that this sort of full gallery and this arrangement is done by and the video is done by the office people. Thank you very much. And one very interesting comment I want to make is that I am working in a center, or I do a private practice in a center, Comfort, and there is a urologist there, and he does this sort of problems. Because these are the problems, shouldering of this sort of problem is very difficult. And every urologist tries to de-shoulder it. Because urea is very high, and if you remove this stone, whether you will pass urine or not, you don't know. And if it does not pass urine, probably you have to go for a dialysis, either thermal or a peritoneal dialysis. So availability of those sort of things is very difficult. And the all important option which is very probably simple, and the facilities available, you can go for that. It's a national problem. You put some catheter or tube inside both the pelvis of the kidney, and the kidney starts functioning very immediately within an hour or 2 hours, and the urea level will go down, and then you can go for any procedure or whatever you like. That is one of the very option, and that is a safe option. And what I have seen probably in doing it in Comfort by Salah. That's why I was saying that. But you have done a very heroic job, and you have said because
juniors are always all juniors usually heroic.
Because
usually not heroic. That is my problem.
Because probably the patient passed urine and he did not do the dialysis. That's why you are said. Thank you for the presentation. And I think if somebody is having a bilateral ureteric stone or bilateral kidney stone, small size, there must be very careful and cautious. They remove either of the stones. Otherwise, any time that patient will turn to this sort of problem. Probably that is the message you can take from this presentation, that if somebody is having small stones in both the pelvis of the kidney, or if somebody is having small stones in the ureters also, probably you must remove the stone very immediately. Otherwise, you may develop this sort of problem, because when the stone descends down and is impacted into the pelvic or uretero-vesical junction, that produces the complete block of the flow of the urine, producing this sort of problem. So the message is that if you have bilateral kidney stones or small stones in both the pelvis or ureters, you must remove it very immediately. Though he is passing urine and he is well up, or he is doing fine with those stones and he is taking homeopathy or otherwise, you must suggest that you go to Professor Abdul Rahman and try to get it removed. Thank you very much.
Thank you, sir. Very much thank you. Now I want to explain some questions arises. This gallery is full, everybody is happy, we are happy. Whole administration is mobilized, we are happy. But thing is that there is some underground cause. This thing, I have taken the opportunity. Our medical college is going to recruit some students from overseas. So coming 6th October, there will be one campaign at Maldives. So somebody is going to Maldives to campaign in favor of us. So this recent program I want to catch and I want to send there, so that this medical college is having these sorts of facilities and they practice it regularly. Recently they have done it. With that point in mind, I have just arranged this, mobilized all this system. Not that this is only for me. That is only for principal sir and his medical college, not for medical college. That is his college and it is for him also. I am just working on behalf of principal to highlight this medical college. The thing I have done, I am very grateful to all the students and all the staff. They have taken this pain and they have arranged it in this morning. Is rainy morning. I am very much grateful to everybody. If there is any question, if there is any queries, you have got any 2 or 3 or 10 minutes we are having. As because we are going lots of questions and answering inshallah. Now still we are having another 10 minutes in our hand. If there is any question, we can. Any question from 4th year, 5th year, even from 3rd year, no problem. And I don't know why first year students here. I don't explain. And explanation is one that Professor আমাদের anatomy professor উনি বলছেন যে কিডনি রিলেটেড সমস্যা যেহেতু আছে তো ওরা তো কিডনি পড়ে so that's why that was the explanation. If there is no question, if there is no, yes sir, please.
Tomato. And tomato contains high oxalic acid. So there may be uric hysteria, and that may precipitate urinary stone.
Thank you, sir. Thank you, sir.
Thank you, sir, for the nice presentation. I think at least we should evaluate him for serum calcium and parathyroid hormone level, as there is bilateral nerve stone, and also for kidneys if there is any, pancreas if there is any stone in anywhere else. Parathormone level and serum calcium
Yes.
bilateral levels.
Definitely. That is called metabolic evaluation. That is, this patient has, because this is bilateral stone, very much indicated for metabolic survey of the system, whether he has got any parathormone which can produce this stone, or other area of the body where he has any factors in his body which is responsible for production of the stone. That is the very good advice from Dr. Dia, that we should go for that. That is called survey to identify the cause, because it is definitely there will be some problem in that sector also. So I think we have covered it. So he will be with us. We will allow the gentleman today, and after another 3 weeks he will come back, and then we will take the stent out and we will follow up. He will be with us. He is very close to us, carrying on, and I think we will be able to follow him. Sir, conclude for us.
সামনে মাসে কার
You just come and attend.
No, sir. radiologist.
Radiologist after one.
Radiologist.
Radiologist the knife.
Sir, also, sir.
बहुत सारे